Hello, good evening everyone. I'm just getting a hold of our guest for today. Hopefully he'll be along soon. That might work.
Hello.
Hello. How are you?
I'm doing great. How are you?
Very, very well. Thank you so much for joining us this evening. Afternoon.
The pleasure.
For you.
Yes.
Dr. Berry, I just wanted to say thank you. Thank you for joining us. I'm going to hopefully get some insight from you about what you're looking forward to about coming to London and the Public Health Collaboration Conference. And as we work through that, I just want to say hi to everyone who's joining. If you have any questions, feel free to pop them into the little speech bubble with a question mark in it, and we can try and pick those up as we go along. I thought maybe we could start with, I could introduce the Public Health Collaboration, you could introduce yourself, and then we can talk about the conference if that's okay.
Sounds great.
Excellent. So for anyone who is watching that is not aware of the Public Health Collaboration, we are a UK-based charity that is all about helping inspire and educate healthcare practitioners and the public about metabolic health. And we exist really just for that purpose. Our vision is for a society that enjoys good metabolic health and where people live long lives free of chronic illnesses. And we do a lot of work in that space, a lot of education. We have lots of resources on our website. You might have heard of David Unwin, who's our chair of our scientific advisory committee. A lot of his infographics are all up there and being used by people all over the world. We have a really great YouTube channel with lots of content on it as well to help people become educated in this space. And what's quite different about our charity is we don't just put information about nutrition out there. We also take a lot of action, particularly in the UK. We have programs. One of them is called the Lifestyle Club, where we're actually working with our National Health Service and taking patients out of the health service, coaching them on type 2 diabetes and helping them put their diabetes into remission. That's one service we offer. We offer a service to help people reverse their food addiction problems, and we now are just piloting another program going into schools and actually helping to change the education system to include a little module where we're actually helping kids understand what ultra processed foods are, how to read food labels, and to inform themselves and set themselves up for life of actually knowing how important nutrition is and how it plays such a big role in their health and also in many other factors that will be of more interest to them when they're younger. So we've got lots of programs like that going at the moment, and we're doing a lot to educate everyone from the grassroots upwards and to also change the system from the grassroots upwards. So that's what we're all about. We have an annual conference each year around May time, and it's coming up in a few weeks now in London this year on the 18th and 19th of May. And we are very, very excited to be welcoming many, many guests along, including Dr. Berry, who we are particularly excited to have coming over because it's the first time you've ever spoken at the Public Health Collaboration. So Dr. Berry, could you just say a quick hello? I'm sure you need no introduction, but just to start us off.
Sure. I'm Ken Berry, a family physician. I've been practicing family medicine for 22 years, and I'm really excited to be coming back to London. Nisha will be with me, but we're not bringing the kids. This is just going to be a Ken and Nisha trip, which we're looking forward to. I'm looking forward to meeting all the great experts who are scheduled to speak there. I hope that many people, if they're not too far away from London, will be able to attend. I understand you guys also are going to offer this virtually if people can't travel to London. And so I think that's good that you're doing that. What I'm looking most forward to is having a steak with Jen Unwin. And I guess Dr. Unwin, David, he can come too if he wants.
Yeah, there will be steak. We're having a dinner on the Saturday night, so I'm sure we can make that happen, and on the Friday night. So I'm sure your dreams will be becoming true not too long in the future. So thank you for that. I know everyone will in this community will know all about you anyway. But there's lots of people who are very excited to meet you when you do come over to London. And you're going to be talking about the proper human diet, as you do a lot, and which has educated millions of people the world over. Is there anything in particular you're going to be mentioning at our conference, or what are the main points that you want to land when you're here in the UK, Ken?
I never know. I typically write my speech mentally as the conference goes on, as I meet people, as I find out what they're interested in. I find out what their motivation is, their mood is. I typically formulate what I'm going to say as I meet people and talk to people at the conference, and also listen to the other lectures. I'm not a big speech writer. I just kind of let the speech happen as it will and as it needs to happen.
Okay, well, we can't wait to see what happens then. And having heard you speak many times, I'm sure it's going to be fantastic and always very entertaining.
Let's hope so. I hope it doesn't suck.
It definitely won't. And it's very exciting for us to have Nisha over as well. Hopefully she will enjoy it. So I mean, looking at our schedule, I don't know if you've had a chance to have a look at our lineup this year. We've got quite a few familiar faces coming along, some less familiar, but very, very interesting doctors and experts that are going to be there. Have any of those in particular caught your eye, Ken, that you either want to hear speak or want to meet?
Yes.
And with that,
pretty much all of them. I don't want to call anybody out in particular, so I would hate for someone to get the big head or someone to feel left out. But let's just say I'm excited to hear all the lectures. I always learn something new, often not a new fact, but just a new way of looking at something, which oftentimes is more important than learning a new fact.
Yeah. And we're kicking off with a whole morning on type 2 diabetes. Dr. Unwin will be talking about glucose monitors. You'll be talking, Gary Torbs will be talking, and then we have a panel all about type 2 diabetes with the three of you, and Helen Gowers, who runs our lifestyle club. And many people have called that the dream team of type 2 diabetes, and getting to hear what you guys are going to be saying. Particularly the name of the talk is "How do we reverse the type 2 epidemic?" So it will be a great one to watch. Do you have anything that you're particularly wanting to get asked or make sure that comes out in that panel?
I just want to make sure that everybody understands that type 2 diabetes is not a chronic disease. It is a toxicity syndrome. Type 2 diabetes is chronic carbohydrate toxicity syndrome, or chronic carbohydrate overdose syndrome. That's all it is. And so if someone was being poisoned with lead or mercury or ricin, you wouldn't say, oh, you've got chronic mercury poisoning, we're just going to have to manage that and give you some medicine. You would say, dummy, stop ingesting mercury and your mercury poisoning it'll go away. It will reverse. And once I think the majority of people come to understand that type 2 diabetes is just chronic carbohydrate overdose, that's all it is. You're not designed to eat that many carbohydrates. Once we're able to shift the paradigm so that that 51% of the adult population, they understand that concept, like, oh, okay, I'm just eating too many carbs. I just need to eat fewer carbs, and my type 2 diabetes will go completely away and will stay gone for the rest of my life. I think that's it. All the other obfuscation and conflation, it'll just go away once enough people get that concept. It's like, oh, well, that's easy. If I have a overdose syndrome, I just need to eat less of what I'm having the overdose of, and I'll get better. Yes, you will.
Yep, absolutely. Can't wait for all of that to come out, and I'm sure much more. And also on that day, Ken, there is a debate, the first debate of the conference. We're having two. The first one is about whether red meat shortens lifespan. And we have on that, we've got Dr. Anthony Chafee, Ben Bickman, and some other more inclined to agree with the statement, opposing speakers as well, who are coming along. Is there anything particularly you'd like to see talked about in that panel, points that you'd like to see made?
I would love I understand that you're going to have one or two people who believe that eating red meat does shorten lifespan. And so I'm excited to ask them what research links they have that proves that, because I'm very obviously I eat a lot of red meat, so if it does shorten my lifespan, I want to know about that. But now I don't care about observational research with a very low odds ratio or a very low hazard ratio. I want to see some research that absolutely shows that to be true, or I want them to stop saying that. And I believe that being in ketosis the majority of the day, that's going to lengthen people's lifespan. I believe that eating lots of red meat and eggs with the yolk is going to lengthen people's lifespan, but I have no research to prove that. So you don't hear me going around saying that out loud all the time because I can't prove that. I believe that very much, and I think eventually that will be proven to be correct, but I'm not going to go out on social media and say that like it's a fact, like it's proven. That would make me an idiot and everybody who listens to me an idiot, and I don't like that. So
Yeah.
I would love to see the research or ask them, why are you saying something that you have no research to support?
Yep. And I mean, there's that question. There's also many documentaries on Netflix and other places which suggest the same thing. So it is definitely a held view in the public that
Yes.
eating more plants and not eating much red meat is going to extend your lifespan. So let's try and understand what is behind that. Let's try and get that on the table. And then also on that day, on the first day, Ken, we're talking a lot about how we can start to change our kids and how they're being educated. And to kick that off, we have Leah Keith, who you recently had on your channel, talking about her experience as a young person and how she was influenced to eat a certain way, and hoping that that kind of message is going to help the younger generation to consider how important it is to have certain foods in their diet that give them all the nutrients they need to develop.
Yeah, I love that. That's a topic for discussion. I think if somebody is in their 30s, 40s, 50s, they're finished growing, they're finished, with their reproductive years, and they want to go vegetarian. And as long as they understand that they're going to have to take a handful of supplements every day to get all the nutrients that they need that are not in a vegan or vegetarian diet, I think that's if you're making that choice for ethical or moral reasons, I totally understand that. But I think it's vital for everyone to understand, especially young parents, that a vegan diet, especially, is absolutely unhealthy for toddlers, for young children. These kids' brains are growing at a rapid pace. Their bodies are growing. They're developing myelin sheaths. If these children need healthy animal fat and healthy animal protein, it's child abuse to feed a young growing child a vegan diet. It's unethical and it's child abuse. And I hope that that message gets out there for the masses.
Yeah, yeah, we absolutely agree on that point, and we're going to be talking about how schools can play a big role in changing that as well, and changing some of the perceptions that are out there in that younger generation who is so susceptible to different messages. And then on day 2, we have another exciting day. We have a whole morning dedicated to metabolic psychiatry, and some of our UK-based experts and doctors are going to be there. Dr. Rachel Brown, Dr. Ian Campbell, who's doing some great research on bipolar and the ketogenic diet at the moment. And they're going to be discussing, and Dr. Erin Bellamy as well, who's doing a PhD on the same topic. They're going to be discussing the major improvements that we see in mental health with diet, and which is becoming very topical, I think, in the kind of low carb space, and is really starting to make some big impacts. And I know you recently had Dr. Georgia Eid on your podcast as well. Is there anything in that segment that you want to make sure lands really well?
Oh yeah, I'm going to try to listen very intently to those lectures. I think if anybody out there is suffering from a mental health condition, they need to immediately watch every video that Dr. Georgia Eid and Dr. Chris Palmer have on social media. They need to read both of their books, and they need to immediately institute a high-fat keto diet, high-fat ketovore diet, or a high-fat carnivore diet. It's going to improve your mental health, at least to some degree.
Yeah, we agree. Someone has just commented that they'd like to see you make a Netflix documentary, if that's okay. Ken, would you mind just doing that as well?
Yeah. Let me jump on that. Actually, I was just interviewed by a couple of guys who are making a carnivore documentary that may wind up being on Netflix. We're not sure yet what platform it's going to be on, but that might make it to Netflix, in which case Huzzah!
Yeah, for sure. Um, and then day two, we then have another debate, and this is going to be a big one, which is our question: does cholesterol cause heart disease? We have Dave Feldman presenting his latest research, and Adrian Sotomotor, and then we also have Dr. Peter Landsberg, who's coming over from the Netherlands, who is a very well established researcher and lipidologist. And we also have someone else yet to be announced on that panel. So that's going to be an interesting one to try and move this conversation forward about cholesterol and heart disease and what is really going on there. And hopefully some of Dave's findings are going to start changing the conversation, maybe allowing others to think differently from what they've always heard in the establishment. Anything you're looking forward to, particularly in that one?
Yeah, I can't wait for those lectures as well. And I think that if we, I was an animal biologist before I went to medical school. That was my undergraduate training. And there's this principle in biology called the adaptation principle. And what it basically means is that if an animal, including humans, if we make a molecule and the majority of the food that we eat contains that molecule, then that molecule must be good for us. It definitely can't be bad for us. And so I think as more and more people learn that the human body makes cholesterol each and every day, it makes lots of cholesterol, as a matter of fact. And then every food that we've proven in anthropological studies that humans ate a lot of also contains cholesterol. And so for all of a sudden in the 1970s, for us to go to discover, oh my God, cholesterol is bad for us, we need to lower that. That would be like discovering today, oh my God, drinking water is bad for you or breathing air is bad for you. We literally make cholesterol, and every food that we ate as much of as we could get our hands on in the distant past contained cholesterol. So for it now to magically be bad for us doesn't really make good biological sense, especially when you consider the adaptation principle.
Yeah, absolutely. And our final panel of the day is going to be talking about ultra processed foods. This has been getting a lot of news coverage in the UK, particularly since Chris Van Tulleken wrote a book last year, Ultra Processed People, and many people are now very alert to the concept of UPFs and trying to avoid them. So we're having a conversation, particularly again about kids and how we can save the next generation from all the dangers of ultra processed food. We have the person who's running our schools program. We have Jane Buxton, who you might know, who wrote the Plant-Based Con. And we also have Eddie Abu and Ben Bickman on that podcast. On that panel. So we think that will be an interesting conversation, especially having someone like Eddie, who's really making a lot of impact on the younger generation and changing their behavior and going to source and doing that directly. Any thoughts on that panel then, Ken?
Yeah, I'm very excited to hear what they have to say on that panel. Ultra processed food is something that human beings have only been eating for the last century. Okay, human beings have been on this planet as Homo sapiens sapien for about 300,000 years. And so for 0.0001% of that time on this planet, we've been eating ultra processed foods. And it's only in the last 20 or 30 years that it's been, for most people, the majority of their diet. So again, back to biology and the adaptation principle, we've only been doing it for way less than 1% of our time on this planet. Now, there are billion-dollar corporations that make lots of money making and selling ultra-processed food. So I want everybody to kind of pull back the curtain and take a peek and think about, so if they're going to lose billions of dollars of profit, I'll bet you they're going to find dietitians and scientists who will say, well, some ultra-processed food's actually good for you. And I did a research study that was funded by Kraft Heinz or Mondelez or whoever that shows that it can be healthy to include ultra-processed foods in your diet. No, it's not. You need to avoid all ultra-processed foods. Now, granted, some ultra-processed food is less bad than other ultra-processed food, but being less bad does not make it good. If you want optimal health, you need to eliminate all ultra-processed foods from your diet and keep it out of your diet and the diet of your children for the rest of your life.
Very clear message. We agree as well. So that's what we're always so excited about, all of those. You're excited about all of them as well, and we can't wait for everyone to come along to London and congregate and for us to spend all this time together. Our conferences have a fantastic buzz, and hopefully you'll agree when you come along. And it's a real mixture of people who are from the public, people who are healthcare professionals, all with one mission to try and move this movement forward and really build this from the grassroots up. And hopefully, being London in the spring, hopefully we'll have some nice weather for you. I can't promise that, but hopefully, I'm sure you and Nisha will have a great time being in London for a few days either way.
Yeah, we're excited. We can't wait to come. We were just talking about it this morning and trying to find the highest rated steak restaurants in the Chelsea area. So hopefully we can all meet up and have some steak and talk about a proper human diet.
Definitely, and I can give you some recommendations on that, so don't worry.
Excellent.
I've tried them all.
Thank you.
So we are really looking forward to having you both, and really looking forward to seeing you in May, and really thank you for your time tonight and for talking about our conference and for coming along. And can't wait to see you in a few weeks' time.
Yes, thank you so much for having me on, and I can't wait to see all you guys in London.
See you soon, Ken. Thanks a lot.
All right, bye-bye.
Bye, everyone.